Chest pain, and she feels like her jaw's falling off. I don't know what to do.
Okay, so just calm down. Calm down, all right? Chill. Now, what did you say jaw pain?
I said she feels like her jaw's falling off. Anyway, can you send her on an ambulance or something?
Okay, sir, does your mom have heart problems?
Yeah.
Okay, well, what's there on the ambulance? What's the address?
532 Skate Hall.
Okay, sir, thank you. The ambulance is on its way.
So for our history, we had a 50-year-old woman who was complaining of chest pains along with jaw problems, and she has a history of heart disease, which her son called in for her. So we have Nurse Wallace, Dr. Gregory, Nobel laureate, and Dr. Rios, MD, PhD.
Why Lynette gotta be the nurse? Why Lynette gotta be the nurse?
So that's the staff.
Okay, our patient presented with a heart rate of 77, oxygen saturation 98%, and blood pressure 129/90. The initial symptoms were chest and jaw pain. She presented with arrhythmia, and we diagnosed that she had myocardial infarction. So we gave her 1 milliliter of lidocaine, which increases blood flow to the damaged tissue, and 1 milliliter of tissue plasminogen activator, which dissolves clots and restores circulation to the infracted area. And gave oxygen because the oxygen saturation began to fall.
Yeah, so those were given like immediately as the patient came in to like restore blood circulation to the infarcted area, and the response to that was our patient flatline. So we shocked the patient back into cardiac rhythm, and after that before he flatlined, we were thinking of either giving him atropine or epinephrine, and we couldn't decide. And when we were like thinking about it, he flatlined. So after he flatlined, we brought him back and we injected atropine. So that we injected 1 milliliter of atropine, which is supposed to prevent slowing heart rate, which would have helped before he flatlined, but it did bring his cardiac rhythm to normal, and his blood pressure was low, so we were thinking of giving him something else, but eventually he came back to normal. And so afterwards we found out that we should have also given him epinephrine, but I mean we couldn't decide. But that's the normal course of action is given epinephrine and atropine. And this is we referred the patient to the world-renowned cardiologist, Dr. Hempel. And we have word that our patient is in good hands and is doing very well.
Excellent. Oh yeah, you got it.
So funny.
I'm gonna ask you a couple. So tell me, who made your differential diagnosis?
We consulted. Yeah, the nurse Wallace mentioned that.
Good job, Nurse Wallace.
She mentioned that those are classical symptoms. Chest pain and jaw pain were classical symptoms of a heart attack. So we reacted accordingly.
And with all that,
All those drivers.
yeah, that's good.
Good job, Linnea. Smile at the camera.
He was 25. His primary complaint, well, his girlfriend's primary complaint was that he passed out after they were jogging, and he took a deep breath and then just passed out. And she shook him to wake him up, and he eventually gained consciousness, but when he was brought in, he was unconscious. So his condition upon arrival was unconscious.
Oh no. And his vitals upon admission were heart rate 182, blood pressure 104/53, and pulse of 164.
Wow. And so the residents that were taking care of him were Dr. Carolyn Smith, Adrian Beaudouis, and our attending was Dominic Lemon, along with our beautiful nursing staff.
Nurses got Jeff
Our first course of action was to give him 1 milliliter of adenosine, and we thought this would work because it would slow his highly irregular heart rate, and adenosine acts by blocking the AV node slow heart rate and relaxes the muscles inside the anterior walls. And his results were his heart rate and his pulse dropped momentarily, but then they began to rise to original level.
Okay, so our second course of treatment was 1 milliliter of propranolol. And we used it because it dilates your bronchioles and dilation of blood supply to voluntary muscles, so we're trying to get the blood out. And the result was increase in heart rate with decreased blood pressure. So heart rate continued to rise.
So at this point we realized that he had a cardiac arrhythmia, which was a regular heartbeat, therefore not delivering enough adequate blood with oxygen supplied to his body, so that's why he collapsed and fell down because lightheadedness, dizziness are classical symptoms of arrhythmia. And since he had just been jogging, you know, his body needs all the oxygen it can get because he's been working so hard. So.
Okay, so our next treatment, we followed the adenosine. We did 3 milliliters of digoxin, and we did this because it decreases electrical impulses to the AV node. So it does. We were reading about it online. It does so by blocking sodium and allowing calcium, and therefore prolongs the contraction. I don't know. Therefore slowing heart rate. Due to technical error by the computer system, not by us, she gave our patient isoproterenol, which sent them into cardiac arrest.
Sure.
So he went in cardiac arrest, and then we had to shock him with a defibrillator. After 1 zap, he was back in.
He's back to normal, and so his stats went back to normal. His vitals were okay, and his girlfriend was able to come and visit with him. He was then referred to cardiologist, and he is underlying current treatment. And we also advised him to walk currently and not jog and run too hard for the first few weeks. And you know, soon he should be back to jogging with his girlfriend Laurel, and they'll be fine.